The story of Florence Nightingale, the woman who birthed nursing, is a story of a godly woman who made sacrifices and choices to her own detriment. Her passion to care for the sick, needy, and casualties was just remarkable, and her impeccable personality defined nursing as a ministry. In this whole new segment on Health in the Spotlight, I'll be hosting some reputable nurses and midwives who will throw more light on the topic. Nursing is more of a ministry than it is as a profession. The episodes for this particular series are filled with educative and exhilarating sessions, and that's what Health in the Spotlight is all about. I'm Rina, and keep watching. I'll be right back with our first interview. Health in the Spotlight is proudly sponsored by Rina's Couture, designing clothing that suit your taste, giving you a chance to be you. H.I.T.S Ultra Sanitary Pad. It's organic, super absorbent, and safe for every lady to use. A very big thank you to Star Bites, the airport branch. Guys, it's a lovely place. Come meet, eat, and drink. To many Ghanaians, H.I.T.S is the most convenient way of addressing nurses. Although it's true that most nurses wear green or white, some don't. For today's episode, I'm privileged to be having a discussion with a midwifery officer. She's here to educate us more on the varieties of nurses that we have in the health system of Ghana. It's going to be a learning discussion, and the purpose is to inform our viewers well enough to know their health workers and identify them accordingly. But before I introduce our guest, I just want to say a very big thank you to Wisconsin International University for sponsoring this whole segment. Today, it's all about knowing H.I.T.S. I have with me today a midwifery officer. She's one of the selfless and most hardworking midwives that I know, and she's in the person of Miss Vera Avenyo. Welcome to Health in the Spotlight, Miss V.
Thank you, Rina.
How long have you been practicing as a midwife?
I've been practicing as a midwife close to 9 years.
Okay,
9
and
years, yes.
Today we are going to talk about everything about nursing and midwifery. So can you please start by telling us the varieties of, do we have varieties of nurses in this
Yes,
profession?
we have several varieties of nursing in Ghana.
All right.
Some are on the preventive side and some are doing the curative.
Okay.
Yes. So when we talk of the preventive, we have the community health nurses, the public health nurses, they are on the field. Yes. And then those in the hospitals, we have the midwives, the registered nurses, we have the psychiatric nurses, the critical care nurses, and a whole lot.
Oh, okay.
A whole lot.
So how do you identify them?
The identification depends mostly on where exactly they work. And the kind of education they had. Yes.
Oh, okay.
Yes.
So is it true that you all wear green and you all wear white?
The community health nurses wear brown.
Okay.
They wear brown. But the midwives, the psychiatric nurses, they all start from wearing green. But as they progress, they wear white.
Oh, okay. Yes. All right. And how is the training like? Do you all go through the same duration of training, or?
The duration is different. Some go through 2-year course. Then some do the 3 years.
Okay.
Depending on the aspect you are entering into.
Oh, yes. Okay. All right. So for those that do the 2 years, those that do the 3 years, obviously I think you will have different qualifications.
Yes, different qualifications. But basically, what qualifies you is you should be in the age of 18 to 34.
Okay.
Yes, you should pass your SSC, that's the WASI. You should have at least less than grade 30 in all the 6 subjects.
Yeah.
Yes.
Oh, okay, all right. So once you've qualified, you've passed your WASI, you can just go to the nursing training college.
Yes, you can just pick a form and apply.
Oh, okay, all right. And what about those that probably, I know definitely before you go to the school, you must have a certain grade.
Yes.
And there's a cutoff point.
Yes.
So those that are not able to make it to the training colleges, what's their option?
If you are not able to make it to the training colleges, most of the time you have to rewrite your WASI to get the grade. To get the grade, because some also do a Bachelor of Science
Okay.
to get into nursing.
All right.
So that also has its own grade point. So you should at least pass your WASI to get the grade point.
So Ms. B, you mentioned about the nursing training college and then BSc. So when you finish, how long the nursing training college? How long does the training take?
The training takes 3 years to complete.
Oh, okay.
Yes.
When you finish, what qualification do you have?
When you finish, you write a licensing exam.
Okay.
So when you pass your exam, then you will be posted for national service for a year. So after the national service, then your main posting for your job will come.
Will now come.
Yes.
Oh, okay, all right. So those that go to nursing training colleges, I know there are some that goes either to the university or the private.
Yes.
What do you then? Is it the same? Do you get the same BSc, or is there something that
No,
is?
for the training colleges, you come out with a diploma.
Okay.
But when you go to the universities, you are doing 4 years. So you are coming out with a BSc.
Oh,
yes.
But that's a cheat, because if you go to nursing training college, 3 years.
They are yet to upgrade it.
Please, they should hurry up.
They
should hurry up and upgrade it, because it's just a difference of
yes, 1 year.
Yeah, exactly. So right now, would you say there's a difference between a nursing trained nurse, that's a nurse trained from the training college, and then those that go to the private or the universities to get their BSc? Would you say there are differences between both nurses?
There are some differences. One is the certificate you come out with. Then secondly, those who go through the government training institutions, they do a lot of practicals at school. So they come out with a little bit of experience than those who go to the private sector. Because the private sector, the practical is minimal. So they come out and learn entirely from the job. Yes.
Oh, okay. So it's almost like they're now coming to learn on the job.
Yes.
Unlike the nursing training students that they do more of the practicals and they are well equipped to some extent.
Yes.
Oh, okay. All right. Let's talk about the once you finish school, people have it at the back of their mind that they are assured of a job. And that is actually one of the reasons why most people are going for nursing. Would you say that there's assurance of job once you finish the training?
Okay, for the government institutions, the job is assured. There's a job waiting for you. You are not going to seek it somewhere else. But those who go to the private institutions, a quota is allocated to them. So you have to apply. And they are all not absorbed at a time. It's gradual.
When you say apply, where do they apply?
Yes, when you come out of school, they all write the licensing exam. You still have to write the license. Whether you are from a government institution or a public institution, you still have to write the licensing exam. So when you pass, you do your national service for a year. Then after that, you send all your particulars to the regional office. So they will factor all of you into the employment list. But they give priority to the government schools.
Before the...
Yes.
Oh, okay, all right. So in as much as you have finished a private training institution, a private school, it doesn't mean that you are really guaranteed of a job.
Yes.
So right now, what would they do?
Most of them, they are all in one way or the other employed, but it's gradual. It's gradual, yes.
So they give priority to the government training?
Yes, they attend to them first before absorbing the private sector.
Why is it so? I mean, we need nurses.
That's one advantage of nursing training.
Okay.
Yes, because the government trained you and the government needs you. That's why they trained you. So they have to at least get that advantage of training you.
All right.
So after that, then they attend to the private
sectors. Oh, okay, all right. But I know that we have Ghana Health Service, and then we have some other. Can you quickly take us through most of the groups or associations that one needs to know when they are applying?
Okay, we have the Ghana Health Service. Then we have those directly under the MOH. Those in Kolebu, the teaching hospitals, they are directly under the MOH.
Okay.
Then we have the QUESI. QUESI is something like a partnership with the private sector, especially the military and all that. They form the QUESI. Then we have the CHAG, the Christian Health. They also partner with the government. So it's a decision to either join Ghana Health Service go to a teaching hospital, or you join H.I.T.S. But these days, I think the distribution is done at the regional level. The students are distributed. Some go to the Ghana Health Service, some go to the MOH, some go to H.I.T.S and PESI.
Oh, okay.
Yes.
So you don't get to choose.
You don't get to choose.
You want to.
Yes.
Oh, okay,
Yes.
all right. But when you're being employed, do they factor in where you stay, or it's like they can tell you that, I mean, they choose where they want to send you to. That's basically what I want to say.
Normally, when the postings come, they post you to wherever they think they need a staff. But when you are posted to a place, you can go back and liaise with them, depending on where you stay, whether it's okay for you. You can still go back. But normally, the posting is done based on where they think they need staffs.
Oh, okay. And I think it will also be based on your qualification.
Yes.
So if you're a community health nurse, obviously you'll go more into the rural areas. Oh, okay, all right. But then, Ms. V, do you all earn the same salary? Even though community, midwifery, nursing?
The salary is a bit different based on your job description.
Okay.
Based on the risk involved.
Oh, all right.
So the salary is a bit different, but not too much.
Oh, okay, okay. Talking about risk, as a midwife, what are some of the risks that you face, or some of the risks that you would want to discuss with us?
As a midwife, one major risk we face is the risk of infections, because we come into contact with body fluids like blood, the liquor, and all that. So the risk of infection is very high, and injuries. Sometimes, depending on your settings, you can even slip and fall. And you come into contact with, let's say, H.I.T.S and all that. So the risk of infection is very high when it comes to midwives.
Yeah.
Yes.
Oh, okay.
Yes.
Talking about H.I.T.S, I hear that's the first one
That's the first
one that comes.
Yes.
So you have to protect yourself.
Yes, because the passage has to be cleared for the baby to come.
You guys are doing a good job.
It's by the grace of God.
Well, I think that you have basically touched on most of the varieties of nurses, but I would like to specifically say, find out that if a community health nurse finds themselves in maybe they are doing the preventive things, preventive measures and all that, but then they happen to find themselves in probably a district hospital. What are some of their job descriptions or some of the things that they would have to do?
Community health nurses in the district hospitals, normally they do the weigh-ins, that's the postnatals. Yes, they do weigh-ins in the hospital. They see to the immunization of our babies in the hospitals. And also, they are also responsible a bit for follow-up visits. Any patient that is seen in the hospital and is being discharged is the responsibility of a community health nurse to follow up on such a patient, to see whether they are complying to drugs, whether they are doing well at home and all that. So that's basically their job at the district hospital.
Oh, okay, all right. Let's talk about working conditions. You were just mentioning as a midwife that the risk involved, and then sometimes most of the time before the baby comes, there's excreta, human waste before. And would you say that your working conditions so far, it's something that is favorable?
It's not favorable. It's not favorable. We can't say it's bad. Yes, the government and the institutions responsible are doing something, but we still need more.
All right.
Yes, because as a health worker, a nurse, the government at least should give you an accommodation. If not a full accommodation, they should give you a little incentive for your accommodation. When it comes to health, we those working in the health sector don't have any health insurance policy.
You're kidding. You're kidding.
It's true.
So if you're not feeling well, you pay your own medical bills.
Yes, it's either you have a health insurance which covers you, or you pay your own medical bills.
But that's not fair.
Whilst we work in the hospital.
Oh.
So that's one thing I think the government needs to implement.
Yeah.
Yes, to help health workers.
Yeah.
And also, they see it as a profession. and we are supposed to wear a uniform. But who cares? Who provides that uniform? Is the staff supposed to provide? No. So all such things are supposed to factor into the working condition. Maybe I want to further my education. What assistance will I get?
Yes.
Because we are serving the nation. So what assistance will I get from the nation to further my education? Because at the end of the day, I'm coming back to serve the nation, to render a service.
Yeah. So they need to support you.
Yes.
So probably, are you trying to say that if you want to go to school and then you want to further your education, you pay your own fees?
You pay your own fees.
I thought there was something like study leave.
Study leave, there's something like study leave, all right. But in every institution, I know just 2 staffs from every institution is supposed to be granted that study leave. No, I can work for 10 years without even achieving that study leave.
Hey.
Because my predecessors, there are people who are working for more years and they also need a study leave. And if 2 from every institution, when will it get to me? So if I want to further my education, sometimes I have to take the bull by the horn.
All right. In as much as I would like to continue with Auntie Midwife, I would like to take a quick break and acknowledge our incredible sponsors. So please stay tuned. I'll be right back. Health in the Spotlight is proudly sponsored by Rina's Couture, designing clothing that suit your taste, giving you a chance to be you. H.I.T.S Ultra Sanitary Pad. It's organic, super absorbent, and safe for every lady to use. A very big thank you to Star Bites, the airport branch. Guys, it's a lovely place. Come meet, eat, and drink. Welcome back, viewers, and I'm still here with Auntie Midwife. Miss V, so talking about promotion, right now you were just mentioning that it takes 10 years for you to work and you're not even guaranteed of study leave. I'm thinking that if you want to promote someone, you should promote someone based on their level of qualification. So if somebody goes to further their education, it warrants promotion. So right now, how do you do your promotion? How do they do the promotion in the health system now?
The promotion in the health system, we have either with upgrade of certificates or you wait for the promotion time. Like when you start working for the first 3 years, you work as a staff midwife. Then after 3 years, your promotion automatically comes. So your names will come out and you have to go for an interview. When you pass, then you get promoted. So with that, you have to wait for another 5 years for your next promotion to come. So within that time, you can choose to upgrade yourself. So after your school, then maybe you take your certificate for your upgrade. So with the certificate, you are automatically promoted.
Yes. The promotion, what kind of incentives comes with it?
Promotion, the only incentive that comes with it, maybe is some amount add up to your salary. Yes. And from there, you have some responsibilities. You are no longer a staff midwife. You are now a senior staff midwife. So you are expected to improve upon your work. Yes. And also you still wear the same uniform, the green. But after the midwifery officer, then you now move to white. Then with the belt, that's the only difference. Belts with staff midwife and senior staff midwife, you all use the black belt.
All right.
But the midwifery officer, you also use a black belt or white belt.
Okay.
So when you move to the senior midwifery officer, you wear a blue belt. So in nursing, it's only the belt and the uniform that
really different.
That is the difference. Yes, that differentiates us.
All right.
Yes.
Ms. B, so would you say nursing is more of a ministry than it is as a profession?
Yes, nursing is a ministry. In as much as we will say it's a profession, it's more of a ministry.
All right.
Because you need to be passionate about it. Caring for someone you don't know, doing what the person can't do for himself or herself.
Yeah.
So you need to put yourself in the person's shoes, feel the person's pain. And it takes someone with a heart for the job to be able to understand the needs of the patient at that particular moment. So if you don't have passion, your emotions are not in it. You can do the job all right, but you do it with a difference. A lot of people will realize that no, you don't have a heart for it, because you have to show empathy. And when it gets to our sector, like this, the women, they are in pain. They will do a lot of things you don't expect them to do.
Yeah.
But sometimes you put yourself in their shoes, ignore whatever they are doing, go all out and help them as much as possible. So I feel we are second to pastors.
Oh yeah.
Yes.
It's a ministry.
Yes. Because at that point, the patients feel they are closer to death, and they see you as their only savior. So they see you more of, even though they call on God, they know here physically you are there to help them, to save them.
Yeah.
Yes.
Thank you so much, Ms. V. I think you've said it all. Viewers, you've heard from Ms. V. To be a nurse, you need to empathize. You need to have the heart. Yes, you must be emotional, but also remember that you are the one that the person has entrusted his or her life into your hands, and therefore do what is expected of you to make sure that they get well. It has certainly been an eye-opening show, but I have to sign off, guys. Thank you, and keep watching Health in the Spotlight.